Geriatrics. The study of old age includes the physiology, pathology, diagnosis, and management of the diseases of the older adult. The broader field of gerontology, or the study of the aging process, draws from the biologic, psychological, and sociologic sciences. Because hospitalized patients are being discharged to home, weaker and sicker than ever before, nurses in all settings, including hospital, home care, rehabilitation, and outpatient settings, need to be knowledgeable about geriatric nursing principles and skilled in meeting the needs of the elderly patients. Gerontologic, or geriatric nursing, is the field of nursing that specializes in the care of the elderly. The standards and scope of gerontological nursing practice were originally developed in 1909 by the American Nurses Association. They were revised in 1976 and again in 1987. The nurse gerontologist can be either a specialist or a generalist offering comprehensive nursing care to older persons by combining the basic nursing process of assessment, diagnosis, planning, implementation, and evaluation with a specialized knowledge of aging. The well-being of an aged person depends on physical, mental, social, and environmental factors. A total assessment includes an evaluation of all major body systems, social and mental status, and the ability of the person to function independently despite a chronic illness. A gradual and progressive decrease in bone mass begins before the age of 40 years. Excessive loss of bone density results in osteoporosis, which affects both older men and women but is most prevalent in postmenopausal women. The muscles diminish in size and lose strength, flexibility, and endurance with decreased activity and advanced age. Back pain is common. Beginning in the middle age, the cartilage of joints progressively deteriorates. Degenerative joint disease is found in everyone past the age of 70 years. Muscle strength and flexibility can be enhanced with a program of regular exercise. The nurse plays an important role by encouraging older adults to participate in a regular exercise program. Regular exercise increases the strength and efficiency of heart contractions, improves oxygen uptake by cardiac and skeletal muscles, reduces fatigue, increases energy, and reduces cardiovascular risk factors. Aerobic exercises are the foundation of programs of cardiovascular endurance conditioning. Swimming and brisk walking are often recommended because they are managed easily and usually are enjoyed by the older person. The social, psychological, and physiologic functions of eating influences the dietary habits of an aged person. Decreased physical activity and a slower metabolic rate reduces the number of calories needed by the older adult to maintain an ideal weight. Apathy, immobility, depression, loneliness, poverty, inadequate knowledge, lack of oral health, and lack of taste discrimination also contribute to suboptimal nutrient intake. Budgetary constraints and physical limitations may impair food shopping and meal preparation. Health promotion teaching includes encouraging a diet that is low in sodium, in saturated fats, and high in vegetables, fruits, and fish. The older adult requires a variety of foods to maintain balanced nutrition. No more than 20 to 25% of dietary calories should be consumed as fat. Protein intake should remain the same in later adulthood. Simple sugars should be avoided and complex carbohydrates are encouraged. Potatoes, whole grains, brown rice, and fruits that provide the persons with minerals, vitamins, and fiber should be encouraged. Drink 8 to 10 glasses of water per day is recommended unless contraindicated by a medical condition. Changes in the respiratory system affect lung capacity and function and includes increased arterioposterior chest diameter, osteoporotic collapse of the vertebrae resulting in kyphosis, diminished efficiency of the respiratory muscles, increased lung rigidity. and decreased alveolar surface area. Gas exchange and diffusing capacity are also diminished. Increased respiratory dead space make the older person more vulnerable to respiratory infections. Health promotion activities that will help elderly persons maintain adequate respiratory function includes regular exercise, appropriate fluid intake. As with people of all ages, smoking cessation and frequent hand hygiene are also prudent health practices. Hospitalized older adults should be frequently reminded to cough and take deep breaths, particularly post-operatively, because their decreased lung capacity and decreased cough efficiency predispose them to respiratory infections and atelectasis. The functions of the skin include protection, temperature regulation, sensation, and excretion. With aging, changes occur that affect the function and appearance of the skin. The epidermis and dermis becomes thinner, elastic fibers are reduced in number, and collagen becomes stiffer. Decreased numbers of capillaries in the skin result in diminished blood supply. These changes cause a loss of resiliency, wrinkling, and sagging of the skin. The skin becomes dry and susceptible to irritations because of decreased activity of the sebaceous and sweat glands. Strategies to promote healthy skin function include avoiding exposure to the sun, using a lubricating skin cream, avoiding long soaks in the tub, and maintaining adequate intake of water, 8 to 10 ounces per day. Changes in kidney function include a decreased filtration rate, diminished tubular function with less efficiency in resorbing and concentrating the urine. A slower restoration of acid-base balance in response to stress is also possible. Older women often suffer from stress or urge incontinence or both. Benign prostatic hyperplasia or enlarged prostate gland is a common finding in older men. Causes a gradual increase in urine retention and overflow incontinence. Prostate cancer, a slow-growing cancer, is most often seen in men older than 70 years of age. Kidney and bladder cancers are most frequently seen after the age of 50 years. Smoking is known to be a primary causative agent of these carcinomas. Adequate consumption of fluids is important to reduce the risk of bladder infections and urinary incontinence. The natural aging process is an inevitable decline of the body's organs, including the skin. When a person is in his or her 20s, subtle visible effects in physiologic skin alterations begin, regardless of external environmental exposure, between 30 and 80 years of age. The epidermis becomes thin, and as the turnover rate of non-structural cells decreases by approximately 30 to 50%. This decrease comprises nutrient transfer and communication between the two layers, affecting barrier, immunologic, and mechanical functions. The decrease in melanocytes and in Langerhans cells increases the risk of skin cancer and infection. There is a loss of dermal thickness in 20% of the elderly as the dermis becomes avascular. Degradation and dysregulation of collagen and collagen synthesis impair the skin strength and ability to heal properly. There is a progressive loss of elastic recovery of the skin. Although the proportion of subcutaneous fat actually increases until age 70, the overall volume of fat diminishes with age. Thinning of subcutaneous tissue in the face, hands, chin, and feet causes the skin to become dry, flaky, and itchy, and decreases insulation, padding, and protection against mechanical injury. Pressure sores over bony prominences often occur in elderly due to the skin's inability to diffuse pressure over these areas. Any break in the skin is considered a wound or sore. Regardless of the acuity of the break, there are three distinct biological phases in the wound healing process of restoring cellular structure and tissue layers. First is inflammation, second is proliferation, and third is remodeling or maturation. All three phases are integral to the completion of the healing process, and they may occur at various rates. Scar formation may occur from excessive fibroblastic proliferation or inadequate healing. All wounds heal with the same process, however, the treatment of the wound depends on its severity and size. The goals of wound care are to keep the wound moist, clean, and free from infection and trauma, as well as to maintain the skin's integrity. Acute wounds usually are abrasions, burns, lacerations, or punctures that are limited to the site of the injury. If optimal care is provided, these wounds may heal 4 to 14 days with minimal scarring. Physical activity has been established to be an independent risk factor for a range of chronic diseases and conditions that threaten the health of the nation. However, only a minority of the population is currently meeting the recommended levels of regular physical activity, which have been linked with important health and quality of life benefits. Older adults are a particular risk for leading sedentary lifestyles. Lack of past experience with physical and active pursuits may also be associated with the lower levels of current physical activity, particularly for older women. Psychological and behavioral factors that appear to be operative in older adults as well as in younger populations include the following motives: desire to improve physical fitness and appearance through the physical activity, positive beliefs concerning the value of physical activity for promoting health and fitness, fewer perceived barriers to the being physically active, and exercise-related self-efficacy.
Ay, push it mo. Push your head. Okay.
Ba't nakangiti ka?
Eh, kasi papasok ako sa pa.
Lemonade!
Ay, yung mga gusto niya pa kayo sa mga tapos po.
Sige, okay. Tingin lang muna sa Ate Jonathan. Seryoso lang.
Tapos, gaganitin ko naman siya.
As we all cry now.
Yes. Oh, yung finish na yun.
Ate, you don't talk.
Can I skip my routine? I am the one who goes to tell you that we're going to do your routine.
Ka.
Prepare for the video.
So we don't talk.
No voices.
Sino?